When visas become barriers, restrictions of foreign doctors and United States healthcare. Hey discoverers! Welcome back to Discovery Learning Hub. Today's topic is how U.S. visa policy under the Trump administration is directly affecting foreign doctors and hospitals across the country, and what it means for patients. Setting the scene. The United States is facing a growing shortage of doctors. Estimates show tens of thousands of physician jobs could go unfilled in the coming decade, and a large portion of the current workforce is made up of foreign-trained doctors. About 1 in 4 physicians in the U.S. is foreign-trained, many of them serving in rural or underserved communities. What Trump's visa policy did. But in January 2026, the Trump administration enacted a policy that froze visa renewals, work permits and green card processing for immigrants from dozens of countries. These measures weren't just at the border. They hit professionals already living and working in America. That includes foreign doctors whose work authorization was suddenly paused or blocked. Nationals from about 39 countries, many in Africa and the Middle East, suddenly found their visa extensions or work permits stalled. Real stories, real impact. Because of this visa freeze, trained physicians who had been practicing for years were pulled off the job. Some surgeons had to stop performing operations, and some rural clinics lost doctors who were caring for elderly or high-need patients. One example, a surgeon from Nigeria performing joint replacements at a New York hospital, a physician from Venezuela treating diabetes patients in rural Texas, all forced to stop seeing patients because their work authorizations weren't renewed. Why this matters? With fewer doctors able to work, hospitals are seeing staffing gaps at a time when the demand for healthcare is rising. Estimates show shortages could grow even larger as more physicians retire and fewer U.S. graduates enter certain specialties. And this isn't just a numbers problem. It affects real patients, especially in rural towns where foreign doctors make up a big part of the workforce. Response and pushback. Hospitals, medical groups, and lawmakers have raised alarms. Some have called for exemptions for physicians or legislative fixes to give hospitals flexibility. But even as lawmakers debate waiving new visa fees or adjusting immigration rules, the policy remains a major hurdle for foreign doctors trying to start or continue their careers here. Closing thoughts. So what does all of this mean? Visa policies that aim to tighten borders can have wide-ranging consequences, not only for immigrants, but for health systems, patients, and communities that rely on foreign medical talent. If you found this video eye-opening, subscribe, and drop a comment on what topic you want us to explore next. Thanks for watching Discovery Learning Hub. See you next time.